Well, an exciting time for the latest update in sport, but we also do have an update. You all remember that pregnant woman who decided to go public as she subsequently got infected with coronavirus and started having all these senses of stigmatization in her community. Well, the pregnant woman is Matilda Gamu, who was stigmatized after testing positive. Now, Kojo Yankson went up north, had an interaction with her and her family, and we'll bring you this piece.
So, Matilda and Bernard, I'm so excited to meet you both. I know you have been through a lot, but I'm very happy to see that you are both well. You have tested negative, and you are back home with your family. Tell me, what was the experience like from the day you were told that you have COVID-19?
Thank you very much. First of all, we give glory to God. Actually, when I fell sick in this house, my father's house, and then I asked my husband to come for me. So he sent me to the hospital, and then the doctor asked, what is the problem? And my husband told him, this is my problem, I can't swallow anything. And then the doctor said that if it is so, I'm suffering from COVID-19.
The doctor said it straight.
Yes, please. But I never bothered, because I haven't seen any results to show that I wasn't panicking, nothing. So my husband was angry that why is it that he quickly mentioned that. So I have to hold him back. But later, when the results came, it shows positive. So they came home here and sent me back. But when the results came, we don't know how it happened, and then the whole news spread before we received our results, my results rather. It even went on Facebook. And then
someone posted on Facebook that
yes,
you have tested positive.
My husband and I.
Even before the results came?
Yes, please.
Who posted? Do you know who? I mean, don't mention the name, but do you know who did it?
No. We don't even know whether it's a male or female. We don't know whether it's a male or female. But we give glory to God. So they came to this house and then sent me back. But the first week, the first month, that was March 28th, that was admitted. And I came home 2nd April, and they came for me 4th April, that's Saturday. And they quarantined me from 4th April to, is it 30th May? Yes, 30th or 1st May that they discharged me.
Okay.
Yeah.
So almost 1 whole month?
Yes, 1 month, 3 days.
Okay.
That was there. But as a pregnant woman, it wasn't easy for me. If not because of few people, my family, my husband, and then church members, they know that as a pregnant woman, if they don't call me all the time, I might think over and then harm my baby. So every day, they keep on calling, giving me quotations to read. Some will even wake me up early dawn for us to pray. So I was there, but the stigma there wasn't easy. I don't see them, but some people can even call. Immediately you pick the call, what they will tell you, you regret for holding a phone on for yourself.
People were calling you while you were in quarantine, being treated.
Yes.
People were calling you and saying what?
That they said, I'm on oxygen. Is it true? They said this. Okay. So
where were you being kept?
at the regional hospital. Even the day I was going to the hospital, my younger brother and then the committee, one of them, they were sending me to the hospital. He is even a witness. One guy just said, brother, I heard that your sister is suffering from COVID-19. No. Just like that. But I never bothered. And I went on my way.
And today you're back home and you're tested negative, right?
Yeah.
They did 2 tests, did they?
It's more than 2 tests.
Okay.
They took my sample, 5 of them, because of the baby and myself. Yes, that was what they told me.
Okay.
They took my blood, my stool, and then my saliva, and then my phlegm. Yeah.
Bernard, tell me about this disease. How did you feel? I heard about the symptoms from Matilda, that she couldn't swallow.
Yes.
How about you? How were you feeling?
I was feeling normal. Nothing was wrong with me. They called me in the afternoon and said that they want to meet me. So I directed them that they should come and meet me at Tap Hotel. So that's the place that I met them. I went and showed them my house, and they said they'll come back in the evening. So that's the evening that they just came back and said that my wife is positive. So I have to quarantine myself in the house, and they'll come and take my samples. I said, okay. So I was in the house almost a week, and they took my sample with my small boy and my mother. So we were just in the house, and the results came, and they said I'm positive. So they have to send me to the hospital. But my mother and the boy are negative, and my wife's family, they are all negative. It's only me and my wife is positive. So when they were 2 weeks' time, they took our second sample. I don't even know what was going on. They did not even inform us whether it's negative or positive. So, and they took the third one again. They said, I'm discharged. Nothing is wrong with me, so I can just go home.
So during the whole time that you were in quarantine, you didn't have any symptoms? No headache?
Nothing was wrong with me. Nothing.
Interesting.
Nothing was wrong with me. But someone just called me from Kumasi, my friends, that they saw me and my wife picture on Facebook that we had escaped. So when anybody who just find out, they should arrest us and send us to the police station and what and what. So because of that, I don't even pick a course again. I was even trying to, I even said that I won't even go to the hospital, but because of our area assemblyman and my pastor forced me that I should do it. I should try and just go because he have faith that nothing is wrong with me. And I said, okay. And my wife also called me. That should be thinking because she believed that nothing is wrong with her. And I said, that is the case. I have to also go. And they sent me there.
So let's now come to the story of the stigma. While you were in the hospital, you were getting these phone calls from people asking all kinds of questions. But at home, other things were happening.
Yeah.
Tell me about your store.
Okay. Actually, when they heard the news that I'm positive, they are my friends, my sisters, and my everything, because you cannot be in one place and there will not be love. So one of them called me and said, where am I? And I said, I'm at home. Then, okay, someone came and said, I'm suffering from COVID-19. Is it true? And I asked, so if it is true, what are you going to do about it? That meaning that if it is true, then they are all affected. Because I come to the store, we sit, we chat, and I even braid my hair there. So they are also affected. That even lost my spirit, my soul just failed me there. Meaning I wanted them to rather encourage me, give me that strength or zeal to stand. But they never did that. They rather asked me questions that would rather lose But I understood myself that it's not everyone that will tell you good things. Others will come with bad news, others will come in with good news. But immediately after their calls, other calls came and said I should have faith as a Christian. That one day, oh, my strength increased and my faith increased. And then I left to the place, to the hospital rather.
Did the Ghana Health Service give you any education or information about what will happen when you come home? Did they tell you to expect that people will treat you differently? Did they give you any information about what you are going through now?
No. When they discharged me, they asked me to go. I should come review on 1 week time. So when I just went home, I was not even feeling good because all my friends are they don't want me to even get close to them. So I don't even have anywhere to even go apart from my house to my wife's house.
Your friends have rejected you?
Yes.
What did they say to you?
They just be saying that they say I have COVID-19 and they don't want to even get close to me again. So because of that, when they even call me, I don't even pick their calls again. And I decided to move myself out of them. I don't want to even get close to them so that someone will say something that it will create fight. So this is the place that I always be coming, from my house to here. I can't even go and do anything. To even go and buy something outside, no one will collect my money. So I have to send a small boy to go and buy maybe bread or something to take.
When you go out to buy things, nobody collects your money?
Don't even collect. Because they know, they believe that I have the virus. They believe it. Even they say that I've recovered, still people don't even believe it. People don't even believe it. So now I'm just nothing. My old lady, they have just spoiled her business. She's selling charcoal. She can't even do anything every day.
So right now, what do you want? If somebody could do something right now for you to make this situation better,
I will be happy.
What should they do?
Any help that they can help us. Because as I'm standing now, I don't even do anything. Now my mother has to cook and feed me, or I should come to my wife's house and eat there. Because of that, a friend of mine just ran. Because that's my friend. We are working together, eating, doing everything together. So anyone that is just close to that person, they have to run and leave him.
What job will you do?
I always go to Kumasi to buy bags and sandals, those foods, and come so that my wife will be in the market and I'll be in the store. So because of that, the market people don't want to see us. And the container, if you even go and open, no one will even come and buy even one piece of bag.
They sent me over there towards the place. Yes.
So it happened over there. Can you show me? Can you go and show me the place? Okay. Auntie.
Yes.
You said you should go where?
That should go behind our school place and buy something, mash kinky and come.
Mash kinky from your school?
Yes.
So you have the people who did this, are they your friends?
Yes.
You know them? But before your mother and your father were sick, they were nice to you? They were friends with you, eh?
No,
they were not friends with you. Okay. So when you finished and you went to buy the mash kinky, did the woman sell it to you?
Yes.
Yes, okay. So where is it, the place?
Just see.
So who is, where? Where the cement block? Or where?
That.
were standing here, just like that. And point, where were the people, the children who were throwing the stones? Where were they standing?
They were standing there.
Over there. So you were trying to go here.
No, I was trying.
You were trying to go here. And they were standing here. And were throwing stones at you.
Yes.
What were they saying?
They said that I am corona. I have corona. My mother is with corona. My mother is having coronavirus. So I'm corona child. They was throwing me stones and I was running, going. People were standing here, they did not say anything. One woman was going and she saw me and said that I should stop and go where I want to go.
So people were standing and they saw you, but they did not do anything.
Yes.
Where were they standing? Over there and over here.
Yes.
And they saw people throwing stones at you and they didn't do anything. How did you feel?
I was feeling sad.
You're feeling sad?
Yes.
Were you afraid?
No. No.
You were not afraid?
Yes.
You're very brave.
Yes.
So after that, when they send you anywhere, are you worried that maybe people will throw stones at you again?
No.
You are not worried. Why not?
Because I am the child of God. I go to church. God be with me. Everywhere I go, God is with me. That's why. I was not worried.
Please tell us, how did you get to know the story of Matilda and Bernard?
So somewhere in March, I happened to travel out. And then when I got back, I started engagement with the municipal health director just to get a sense of how much I could support, with the fight. So in the process of that, the reporting at that time was basically identifying which regions has reported a case and which community. So one day he called me and said, we have a case on our hands, and it turned out to be this family. And he said that the circumstances of the first case were said that it had generated some controversy because the handling of it went out of hand, and because of that, the level of secrecy that was required had basically been broken because it was out there in the media. Then I had a call also from Reverend Isudanaba, who wanted to find out from me whether I had heard this case because he had also read it, and he was very worried that we needed to find a way to contain it from spreading. So that was how I got to know that we had a case like that. And then subsequently, when the man's issue also came up, because like he himself explained, there was some level of misconception around this disease, and he didn't feel that he had it because everybody thought that once you had it, you needed to show some symptoms. And those were the early days when not much was known about this disease. The fact that you can be asymptomatic and all of that was pretty new to us. So there was some story in the community. The assemblyman for the area had contacted me to say that he wanted me to check with the municipal health director over this case, whether or not the appropriate protocols were being followed, because at that time they didn't know that you could be isolated in your own house. So still finding him in the community created some bit of uneasiness. So I had to get in touch with him, and he then explained to me that it is not in all cases that the person is isolated in a hospital, and that even in some instances where the home environment is conducive, the person can actually be treated when he's positive in the house. So I had to convey that message back, And the assemblyman did a great job by trying to manage the expectations of the people and to get them to understand some of the protocols that, for obvious reasons, didn't need to be communicated to the community. So that is how it happened. And you can see that the earlier misunderstanding of the disease impacted how their relationship with the medical team went. And so the community as a whole began to feel a bit afraid, because this was a disease they were hearing way back in the US and in the UK, and they were hearing stories of how people were dying out of it and how people were on ventilators and things like that.
And to think that they were living, it is now in their community, was a bit difficult. And so we needed to find a way to educate the people on this. But so far, I think we are beginning to understand it a lot more. The stigma aspect of it, which I raised when I actually have a team that I've put together, which is going around all the communities on a daily basis, educating them and providing them with some of the equipment and the things that they need to keep safe. So in launching that particular group, that campaign group, which I made the Municipal Health Directorate to put together, I insisted at that program that my biggest fear was that stigma could become a major problem to deal with. And so I had hinted the media that I had invited to assist with the communication and the public education, that they needed to look out for ways by which they could assist us to prepare the minds of the people towards the possibility of stigma. And so when this came up, I was like, well, we anticipated this. We probably haven't done enough since then to put the issue of stigma ahead in our frontal in our public education. It's been more about prevention and prevention and prevention. But I think that now we need to move forward to incorporate more of the stigma and other related issues. And that is why I see them as very good ambassadors who, just like our brothers and sisters who were the unfortunate victims of HIV in the earlier days and suffered victimization, it took some of them to come out and to say that I don't care what it is, I need to educate people. And when people began to hear from the people who themselves were affected, it helped to demystify the disease. Because when people are stigmatized and they have it, chances are that they will think that they must go down with everybody. And if they don't have the right emotional stability, they may end up infecting all of us intentionally, yes, just as a revenge on the community. And we don't want that to happen.
Obviously, one small but important difference between the ambassadors for HIV and Bernard and Matilda is that they are actually free.
Yeah, exactly.
But still, they can play that.
Yeah, they can play that role. Yeah, but also that, like you said, they feel a lot safer than us because I haven't been tested. Until I begin to show symptoms, the system may not even target me for testing. And if I'm asymptomatic, I may actually get out of it without knowing. But they know their status. And I want to encourage people to understand that we need to integrate them back into society for them to live their normal lives. We cannot continue to keep capable hands incapable and then treat them as social welfare people. I don't think that is sustainable.
Behind me is Matilda's shop. This is where for a number of years she has sold all kinds of women's accessories, from handbags and so forth to all kinds of other knickknacks for ladies. Right here on this street, which leads to the regional hospital here in Bolgatanga. It's a rather busy little street on a normal day, but as you can see, Matilda's shop is closed. The question is, can Matilda return to work comfortably, safely? How do her neighbors feel about her returning to work? COVID-19 is a reality for all of us around the country. What is the reality for them in this community? And how do they feel about Matilda coming back to be amongst them? Let's find out. Let's speak to them all. Hello, good afternoon. So tell us, how did you hear that Matilda is not well?
For me, it is just recently that maybe people were talking. But me myself, I don't even see her with my eyes since about 3 months ago. So before I heard this. So since then, up to date, I've not even seen her with my eyes. This is what I've heard.
But you have heard that she's
yes,
not well?
Yes, I have heard it.
She has recovered from COVID-19.
Okay.
How do you feel about that?
Okay, for that one, I have not heard it. So since I've not even seen her, no, I can't tell whether this is what is happening to, but I can't tell. Yeah.
Okay, but now you know.
Yes, now I know.
So how do you feel about it?
Oh, it's normal. After sickness, it can cut anybody at all. And that one, it doesn't, and we even heard it, we educated more about it, how the sickness or the disease goes on. Whether we shouldn't stigmatize anybody, whoever recover from coronavirus. So far as our sister Mati is recovered, we don't have problem with her at all. Anytime she comes out to work, we also work together as a brother and sister. This is what I have in my mind.
Tell me, how do you know her?
We started working here 2016 rather. So she saw her things and I'm also here. We are just like sisters. So when I heard it, I called her, but she didn't pick. So when I also heard that she has recovered, I thank God for that. I'm happy. So if she come, I have no problem with that.
Have you spoken to her since she became sick?
I didn't even see her.
Now you have a hairdresser's salon.
Yes.
So was Matilda one of your customers?
Yes, at times she come and do her hair.
So when you heard that she had COVID-19, were you worried that maybe she could have infected?
I was praying for her to recover. And I thank God that she has recovered now.
I mean, were you worried that maybe she could have infected you or any of the others in the area?
No, she has stopped coming here the whole of this year. So I didn't see her. We used to see each other, but not here. But when I heard that, I was worried because she's my sister. So if she recover now, I'm okay. I'm happy for her. But if she come, I have no problem with that.
How about the rest of you? How do you feel about your sister coming back?
We thank Allah for her recovering. That's what I can say for now.
So, do you know much about the disease, how it works?
Yes, we normally watch television and we hear what they normally talk about the diseases. So, much.
Are you worried that Matilda might infect people?
No, as for that one, because they say we should prevent, we should distance ourselves from and regularly wash our hands. So we go by those rules. So we know, inshallah.
But have you been told that she has actually recovered?
No, it's just today I heard. I learned that she has recovered.
Do you know what it means if they say somebody has recovered from it?
We've been hearing on news saying that people has recovered, but I haven't seen her with my eyes, so I can't.
Okay. Well, when somebody recovers, it means the person does not have COVID-19 anymore.
Okay.
So they have tested the person 2 times, and the person does not have COVID-19 anymore. So I, for example, I've never been tested. So as I'm standing here, I don't know if I have COVID-19. I don't know. But Matilda, she knows. She knows that she doesn't have it. So Matilda is safer than me. Do you understand what I'm saying?
Yes.
Yeah. Because she has been cured. She's recovered. So for those of the people in the community who might be worried, do you have a message? What message do you have for the people who might be worried about Matilda coming back?
As for her coming back, there is nothing to worry about because we thank God that she went to that place and recovered. So we just wish her well. That's what.
How about you? How do you feel about her returning? Tell us the truth. You know, if something is worrying you, I want to know.
Thank God that she have recovered and come back. No, it's okay.
Are you worried?
I'm not worried.
You are sure?
Yeah.
Because, you know, we came here to hear from you, to hear about your concerns. You are not worried. So where is your shop? Where do you sell?
My shop is glass.
But you know Matilda?
Yeah, I know Matilda.
What do you know about her?
She's a friend and a sister. This is a shop. Normal she print things. We always come and buy from here.
What's her character like as a person? What's she like?
Like jokes and friendly.
You were saying the same thing? And what's she like?
She just friendly. Like I don't know her much. I just came in recently, but the day she just met me, the way she just received me as if I'm her own sister. That's what I'm talking about.
How about you? You know her?
No, I know her. She doesn't have problem with anybody here. Since we met here, I don't think we have problem with her.
So if you can give a message to Matilda and her family, what will your message be?
To me, they have to thank God for Matilda, because it's not easy to be at that position. They have to sympathize with her and get closer to her so that they'll encourage her. That's my advice to the family.
So are you looking forward to her coming back?
Yes.
Let's zoom in on the story that brought us here.
Okay.
The case of Matilda Gamu and her husband Bernard.
Yeah.
What can you tell us about that case and how it was managed through the health?
Yes, it's the first case that actually we confirm in Upper East region here. And that case was managed at the regional hospital treatment center. And as part of the contact investigation, the husband also tested positive, which has also been managed successfully. So, I mean, she was a pregnant woman. Out of her, a number of people also got infected. Some are still under management, but some have recovered. So it's been quite successful. We are still waiting. You know, she was pregnant. She's not delivered yet. So we hope to do more when she delivers, to find out if the child gets infection or something.
What are the chances of that happening, the child being infected?
We know that some of the viruses can cross the placenta barrier, but we also know that sometimes that barrier can be quite tight and the virus may not be able to pass through. So we are actually, I mean, it's going to be a learning curve for all of us to know what really happened.
Examples of this anywhere else in the world?
I have not really. I know that pregnant women have been delivered, but I've not really had any literature on it which talk about in utero infection of that nature. So we are going to learn from her as far as the transmission in utero is concerned, and we're going to make sure that the delivery is conducted in such a way that there is IPC, infection prevention, and all the measures appropriately taken.
So you put together a unique delivery plan for her?
Exactly.
Okay. And you'll be monitoring her?
Yes, we'll be monitoring her.
Okay. Now they tell us that when they were treated and they recovered, or they were told that they have recovered and they can go home, they were given a referral date and sent home. And that was that. They went home to face massive stigma, difficulty reintegrating into society. As we speak, she has been unable to resume her work in the marketplace where she has a stall. Her child was stoned by other members of the community. Can you tell me how this could happen? Why was there no counseling for the community as a whole to let them understand what has happened and that these people are now safe and able to join them? Why was there no follow-up to the discharge of these two recovered people?
We have a clinical psychologist that counsels them, all the patients. Even while they are on admission, they are all counseled. And during the discharge, they are also counseled. It is a fact that we have not met the community as a whole, because that also has some implication. There are some of the patients that we have discharged that have said that I don't want you in my community, because when you come there, I'll be stigmatized. The people in my community will get to know that I was one of the patients. I'll be stigmatized. So it's a very dicey issue, which we need to look at how really to proceed. But in her case, because the community has done what we do not expect them to do, because it's quite unfortunate to stone the child just because the mother has had infection. And this is an infection that all of us are vulnerable. I mean, today it may be her, but tomorrow it will be any of those community members. And who even says that some of them may not have the virus? It is just because they have not been tested. So it's very, very unfortunate, I mean, to have people who have recovered fully from the virus being shunned.
So I guess what I was asking was that in this case, where it was known, it wasn't a secret. They had already mentioned several times to the healthcare workers that it has been put on social media that they have COVID-19. It's known. The stigma started even while they were under treatment. The child was stoned while the mother was on admission. So there was ample warning. Why did the healthcare system not step in and provide that community support so that they could return safely? Why simply send them home?
Yes, it was not really known, because I can tell you that social media put a lot of pictures of so many people. I personally had calls where they said they have found the husband here and there, but the husband was not there. There was a lot of guesswork that went on in the community. A lot of people put pictures of people they did not know, I mean, of whom they suspected that they were the ones. But it's difficult to predict that the community will do such a thing.
Even in this instance, when it happened while the parents were on admission?
In fact, this is the first time I'm hearing that the son got stoned.
Oh, you didn't know at all?
No, I've not heard it. This is the first time I'm hearing that the son got stoned.
That's interesting.
Yes.
But that means you have not been following up with the family?
No, we've been following up. But, I mean, it's not every incident that may be brought to your attention.
So you've been following up, but the family
Yes.
did not inform you of this?
Yes.
So when was the last time you visited the family?
No, we have a team that visits the family. Yes.
When was the last time they went?
No, when she was discharged. After she was discharged. They followed up.
Since she's been discharged,
Yes.
a team has been to her house to visit her? That's what you're saying?
Yes.
When?
I can't tell the date, but I know that the team follow up. Now we have, like I said, the clinical psychologist is both in the facility and a follow up, because that's her task. So because of that, we've been relieve her of some of the activities in the hospital.
Well, and you do know that stigmatization has always been something that we frowned against or upon. And subsequently, this story also brings to bear the related issue and how we need to clamp down on this. That was a good one. Great interaction by Kojo Yankson. And I have to tell you that all of you who have been watching it would have a lot to say about this. And we'll open the phone lines very soon. Make sure that you get interactive. But it's not only here. We have Facebook, and we've had a number of comments also when this was first posted on Twitter and then also on Facebook. But Joy News TV is our official channel on YouTube, Joy News TV. Make sure that you go subscribe, click on the notification button, which is like a bell, the deep one, or the gray one, so to speak. And then you will get the notifications on your tablets, on your phones, smartphones, and definitely also on your laptops when you are on stream online. But look, how has this also started a conversation in your mind or on your discussion platforms? Make sure you call us. We have the numbers, and as you get interactive, you can just call through the number 030-2211-691 or 2. Again, 030-2211-691 or 2. Let us know what you think about how this pregnant woman would have to go through this period, traumatized and now stigmatized, but is fighting back in her society or her community. And it's also because her member of parliament, the constituency where her home is located, Isaac Adongo, also brought this to the fore. And this interaction by Kojo Yankson brings the related issues to the front burner for us to make sure that when somebody is not well, rather they need our support. And we have Abdul Ganil from Mankregu on the line. Good morning to you, Abdul.
Yes, good morning.
Good morning. How are you? And how has this story moved you, Abdul?
Wow, I'm so sad, Roland. I'm so sad. First of all, good morning to you and good morning to your viewers and good morning to my people in Savannah region, especially Mohammed Isa. Roland,
sir,
I think what I followed Joy this morning and I saw in Upper East is very sad, and I feel what the man and the woman did, because some people will never come to do that, because if they have the will to come out boldly without covering their face, without hiding themselves, but they are public, telling what the experience they have. So not less as Ghanaians, we shouldn't be doing these people like, what is the name? They are not human beings. Like what is the name? The former, the information minister, several times he said it. If they tested her or him as, what is the name? Negative, positive, and later they tested them negative, we should let them come together as friends and sisters. But we shouldn't be running away and leave them. If they are coming, look at what the guy said, Roland, that if he even want to buy something, they will take his money. Oh, Ghanaians. So if I sick, Roland, I'm not supposed to do anything again, even eating. Can I even get something to eat? Roland, it's unfortunate. People shouldn't be doing this. If you did this, if you do this, Roland, you don't know. God can use what you just neglected your colleague, human being. God can use that to punish you. To just know that he can do what he wants. It is Allah's will. He likes to just let them know that he has the power, so he can test any of us in this world. So we shouldn't be hiding ourselves and leave them, or we shouldn't be doing them like what the guy explained. If they want to buy something, they can't. If they look at the young girl there, their daughter.
Yes.
She can't even go anywhere. Look at the stones that they are throwing her. It's not good. We shouldn't be doing this. So are you telling us that almost 400 and something people that's recovering? If you are going to be doing this to them, definitely they will die and leave us. They will die. Because if they tested you positive, at the end of the day, God willing, and you are recovering, people will not even come closer to you. So if you die, it's better. Because we need people to be recovering. This virus, we don't need people to be dying like that.
Well,
like
definitely, Abdul. Well, we have to go to Wale Wale, and it's where Mohammed is calling from. Good morning to you, Mohammed.
Good morning.
Yes, and what came to your mind when you watched the story? A very emotive story.
Yeah, but at first when the issue broke up at Upper East, they were saying that the woman was tested positive and later on they fled. So now your man failed to do for me, or what I am disappointed about, he failed to act where the woman get the disease. Because I don't know whether the woman have a travel history, and all of us know that the disease does not degenerate inside. You have to infect or pick it from somewhere.
Well, Mohammed,
So
what's your point?
Yeah, my point is the story seems not being clear, or some fishy in it. Because where does the woman get the at first when it brought out, they said the woman and the husband. That was what we heard. They said they ran away.
Yes,
so
I get your point, but I'm saying that where she got the disease, or where she did not get the disease from, how does that become material to others?
It's not a problem because the disease does not emanate from inside from a person. You get it?
But if she got it from somewhere, which definitely she did, why should that lead to her being stigmatized? Mohammed.
It is unfortunate. It's unfortunate. The people or the community members that did not try at all, because all of us are human. If it is me today, it could be somebody tomorrow. And so therefore the stigma, it is unfortunate that even stoning the child and other things. Oh no, that for that one, it's unfortunate. It's unfortunate. They shouldn't have do that.
Well, please, you can still call 030-2211-69102. We do have Raindorf Owari from Oyarifa on the line. Raindorf, good morning.
Good morning, Roland.
Yes, please. And I'm sure definitely you were moved by the story.
Yes, please.
Your comments subsequently.
Okay, Roland, I think it's high time we use people as corporates. And it's been a very long time. And I think the government is delaying in making laws that will make this thing illegal. Because it has, if today is COVID-19, and before COVID-19, there were other conditions where people were being stigmatized against. People were being stigmatized against HIV, tuberculosis, and even divorce. There are several conditions that people have been stigmatized against, and we've been sitting idle today. So what are we doing as a country in curtailing this problem? Because if we don't act now, very soon somebody will be killed. And if we don't take care, and if we don't act swiftly, people will commit suicide. And is that what we want? And if we don't take care now as well, there will be lots of people who will not be willing to show up even if they are positive. And that will make the thing really worse for all of us. So I think the government should act as early as possible to enact laws, and if the laws are being made, it should be fully implemented, whereby people who are not doing the right thing, who are stigmatizing against victims, should face the law. And if we can't afford prison terms, there should be community service where they themselves will be used as volunteers going around and educating people against this stigmatization. So I think this is what the government has to do. And the community, we should know that if it's affecting Mr. A, tomorrow it might be me. And one thing that we have to know is that those who have been tested positive and now they are cured, they are the best people to even associate with. Because we know their status. But me that I'm talking to you, I don't know my status now.
Yeah.
You, Roland, you don't know yours. But people love to come closer to us. We that we don't know our status. But that is very dangerous.
Yeah.
So the earlier we act, the better. Thank you so much, Roland.
Well, thank you, Raindorf. Very insightful and comprehensive there. Raindorf calling us from Oyarifa right here. And now let's go to Sadiq, and he will be our last caller. He's calling from Lambusi. Good morning to you, Sadiq.
Morning, boss.
Yeah. What came to mind when you watch how traumatized she was? Can you please reduce the volume on your set?
Morning.
Morning, Sadiq. Please reduce the volume on your set, please.
In fact, sad. I'm very sad.
And go ahead. Well, Well, we lost Sadiq there, but we all do know that stigmatization has come about because of people's misconceptions. And one thing that people have always had misconception about is adopting technology. And it is within this period that it's now been adopted a lot more in the education sector. Because schools have been closed, schools have now been compelled to use alternative platforms, virtual platforms by which they have to conduct teaching and learning. And that was started by many basic schools, and subsequently other sectors of the education ladder also started. And schools were told went on vacation. Now they have reopened at the basic level. And some parents and school authorities or owners have been compelled to pay fees, or sometimes to pay some sort of fees so that teaching and learning could be undertaken on these virtual platforms. But a lot of parents, as well as even the school owners or the management, have a lot of issues to say in terms of trying to convince either side to accept why cost has become very relevant and how these learning or virtual platforms are being undertaken. We want to comprehensively look at this. If your child is going through learning using the internet and other internet-related platforms, there's a time for you to join in this conversation as well. It's up next.